Misclassifications in a patient's medical history can result in false information lingering on in their medical records for years. Are the terms intolerancia and alergia synonyms? Let's take a look at the following example. A patient's medical records indicated an adverse reaction to non-steroidal anti-inflammatory drugs. The original report, written in English, referred to NSAID intolerance. In the Spanish translation, this item was recorded as alergia grave a AINE, and this is where the problem began. Medically speaking, an allergy describes a state of hypersensitivity to an antigen that is mediated by an immune mechanism. An allergy causes the body to have an abnormal, harmful, and sometimes even life-threatening reaction when exposed to that antigen. Consequently, if a patient is allergic to a medication, it makes sense that such medication not be given to them under any circumstances. An intolerance, on the other hand, is an adverse reaction and the result of a patient's low threshold for a given drug action. Consequently, if the drug in question is administered within a reasonable threshold, depending of course on the patient's degree of intolerance, there are safe dosing alternatives available. In other words, having a drug intolerance does not necessarily equate to an absolute contraindication for taking that drug. In the case of this patient, the fact that NSAID intolerance was mistranslated as alergia grave a AINE prevented them from being safely prescribed NSAIDs for years, even in circumstances of acute post-surgical pain. Later on, an allergological reevaluation would reveal there was no drug allergy at play at all, only a drug intolerance with no immune system response involved. In other words, the patient could have been safely given NSAID alternatives, had the term been properly translated from the outset, of course. Our terminology resources cover a wide range of meanings, translation equivalents, fields of application, and examples. Their authors are professionals in lexicography, terminology, translation, writing, and editing, all of whom specialize in biomedical sciences. This means that our resources cover considerable nuances that become relevant when trying to make sense of a term in a healthcare setting. This is just one example of how to make decisions when terminology matters. Cosnautas has been designed for dedicated, thorough professionals who care about these decisions. Explore our platform and see for yourself.